Today we're going to be going over donning and doffing, using a PAPR and the required PPE for taking care of a person under investigation for COVID-19 or an actual positive COVID-19 patient. We highly recommend using a trained observer to both don and doff for the safety of the employee. The trained observer will assist with the donning and doffing, inspect the PPE ensemble, go over the checklists which we have hanging on the wall, and then also will be cleaning the PAPR, in this case, at the end. So Nancy, let's get started. We're going to be donning our PPE for use with the PAPR. And if we follow our checklist, which will usually be taped to your isolation cart or maybe to your wall, I would first ask Nancy if she's taking care of her personal needs. You know, did she go to the bathroom? Did she hydrate? Is she ready to be in the room for a little while if that happens to be the situation? We would ask her to remove personal items, and that means watches, rings, necklace, earrings, kind of the works. And I guess if you know you're working in an isolation unit, you should come to work without these things, because these are just items that can become contaminated and be a problem for you. If you are working in an isolation unit, the emergency room or our respiratory therapy clinic, we also recommend that you wear hospital scrubs while you're at work, and that you change into them in the morning and change out of them in the evening, and leaving them here for HFM to launder for you. We have forms that we use to indicate, do you want to pick that up, Nancy? Who has gone into this room, and that helps us in case we have an exposure or in case we have a person under investigation and they eventually come back positive, so we can make sure that everyone had the appropriate protection while they were there. We will start with hand hygiene. Nancy, please wash your hands with our antibacterial waterless soap. Next, we will put on the gown. These are isolation gowns. They are one-time use. We do recommend that you make a little tiny tear in the back if you have trouble getting it off, because some people do. At this time, the trained observer can help by tying them up in the back and kind of making sure they've got everything on appropriately. And then I'm going to help her put the PAPR on. So Nancy, if you want to grab the PAPR. Before we use the PAPR, we want to make sure that the battery is adequate for us while we're in the room. And we do that by doing a test, turning the PAPR on and putting the device where the hose is attached. And if you can see, the ball is above the black line, and that is what that is our goal. Then we know the PAPR has adequate battery power for us. And then this is our newer PAPR. It's called the Sentinel XL. It has filters on either side of it, and the hose screws on to both ends, the machine and the hood. So I'm going to hold it for Nancy just to help her get this on easier. And for training purposes, we're not going to put the hood on. We're just going to hang it over the shoulder to keep it clean. However, if you look at the hood, you can see that Nancy's going to have full coverage of her face, and eye protection is a part of the PPE for this particular disease. So she will have eye protection with that hood. And so once the hood is on, I would say finish by putting your gloves on, Nancy, and then you're ready to go into the room. Okay, so now Nancy is ready to come out of the room, and you can see how the hood is on in front of her ears, so you can use a stethoscope in here. Ideally, we would want her hair gathered up in a ponytail and stuck underneath the hood if possible. So me, as the trained observer, is going to take a look at her, and I'll just have her do a little spin to be sure she doesn't have any obviously stained areas. If she did, I would hand her a purple top sani cloth and ask her to wipe that off, because then there would be less chance of contamination as she doffs her attire here. Okay, Nancy, please show us how you're going to remove your gloves. Hand hygiene, please. We're doing this because our next step is we're going close to our face with our hands to remove our papper. So she's going to put a new pair of gloves on. And we're trying to keep everything we put close to our face as clean as possible. At this time, the trained observer is going to start helping her, and the trained observer will have a pair of gloves on. So I'm just going to hold her papper in the back as she removes it. I'm not letting it come into contact with me or her, and we put it on a hard surface because we need to clean this device. The trained observer can help untie and kind of get the gown started, but Nancy's now going to remove her gown and gloves together. And I'm just watching to make sure that she's getting the dirty side rolled in. She's not contaminating herself, because this is the most important part of donning and doffing. You do not want to contaminate yourself, and that's what the role of the trained observer is here, to make sure you don't contaminate yourself. And then it's going to be discarded in regular garbage, and we will end with hand hygiene. And I, as the trained observer, will take a purple top sani cloth, and I will wipe the exterior of the papper. I will wipe the belt. I will wipe the hose, the outside and inside of the hood, including the visor area.